Bienvenidos a todos! Welcome to Millennial Mental Health Channel. Been a while since I had a Spanish opening. I like to do it because it makes Eddie feel happy inside. How are you doing, my friend?
You know, if you actually listen back to the last episode, he also did a Spanish intro. So, like, now I think it's... I'm just kidding. I'm making that up.
I was gonna say, wow, now I just seem very insensitive.
No, you are correct. I do like it. I enjoy it very much. I think you asked how I'm doing. I totally forgot because I was already ready to answer you. I'm good. It's good to see you, my friend. I always say I'm excited for today's episode, so I'm going to say I'm not excited for today's episode. But I'm just excited to talk to you.
Perfect. I appreciate your honesty. And I know you're lying. But I heard you're getting AC in your house. I'm very happy for you. This will be able to cool off.
That's the hope, man. That's the expectation. I guess things can change between now and Friday, but that's the goal.
Well, I wanted to warn you that my upstairs in my house does not get great airflow, so I'm officially in the hot season in Omaha, Nebraska, in the Midwest. So if I randomly take off my shirt during this episode, it's because it's way too hot in here, and also a little incentive for our YouTube viewers.
We're gonna highlight that on the little shorts and the reels that we post and the TikToks. Justin shirtless. I'm gonna like take off the volume and I'm gonna add different music and then it'll just be you shirtless. Okay, that's enough. All right.
Slowly taking it off. Nothing gets the viewers like man boobs. That's what I've learned.
That's what I've heard. That's what the research shows. I don't know.
Well, mindfulness moment for today. We just recently added this to the show. Eddie, mindfulness question for the day. What is your purpose in life?
I'm shaking my head because I read this hours ago and I'm like, how the fuck am I going to answer this? I think I'm just going to say to help others. I think we choose this profession because it's something that we want to do. We're mental health professionals because it is important to us. I've had kids tell me all the time, you don't actually care. It's your job to care. And you're absolutely right. Technically, I get a paycheck to care. But if I didn't care, I could definitely do something else. So I genuinely care. And I think my purpose is to help others. What about you?
Yeah, well, even to follow up on that, I've had patients when I'm doing something that they don't want, they'll say that. They'll throw that out. They'll be like, you don't care. You're getting paid to be here. Yeah. Like, doctors make bank. You don't really care about me. And I was just like, I could have gone into surgery instead and made twice as much, but I chose to help you with your mental health. So, yeah, we do this because we do really genuinely care. And
could have drove a sick-ass sports car.
Yeah, I know. I could have had a Jaguar. I could have been just flying around in Omaha, Nebraska. But I didn't want that life. Honestly, right. I feel like my purpose in life was to be a dad. I've always kind of felt like that. I've always really wanted to be a father. And as an evolutionist, I thought there is nothing more important than having a child and not only passing your genetics, but your knowledge and your love and your worldviews on to the next generation. And hopefully I don't scar my boy too much. But yeah, always really wanted to be a dad. So really, really happy that happened about 2.5 months ago.
Well, we got to ask Liam if you scarred him yet. I'm assuming no, but get him on the show. Know. Get him a microphone.
He's our next guest. He's not going to talk much, but he is a rather flatulent young man. So he'll
45 minutes of baby noises.
Baby noises and baby farts. He's going to be great at it. Yeah.
Most listened to episode.
Well, today we are talking about postpartum depression. Which I want to address the fact that this is two men talking about postpartum depression. I did have a friend and coworker who's doing a fellowship in ladies' mental health, and she had told me that she wasn't quite interested. So we made an effort to try and get more gender diversity, sexual diversity in this episode, but honestly, I just had a baby with my wife. We have a 2.5-month-old son, and it made me realize just how hard having a kid is, especially on women, how stressful it is. It allowed me to see this process and everything that they have to go through. I was lucky enough to get a month off of work. That was such a blessing. And my wife doesn't have to work right now, luckily, so she's had all the time. And it made me think, like, how do people do this?
Yeah.
That most people I've talked to said, like, you got a month off? Man, I got a week. I had to pay to get time off to have a baby. Most people do this in a week or two. And it blew my mind that most people in America get zero support from their employer to have a child. So I wanted to talk about this on the podcast. We've had some listeners request a postpartum depression episode, so it was time.
Mm-hmm. Yeah, you think about it. In the different jobs that I've had, people were talking about, like, oh, I'm about to go on maternity leave, paternity leave. I had to go on short-term disability to even get any kind of money, or I had to. I've been saving vacation days for 3 years just so I can have some extra time off. Like, paternity and maternity leave in our country is ass. It is not good. It is. Anyway, we'll talk about it. We'll give you some stats and facts. I'll start off instead of just rambling. One of our stats and facts: each year there are about 3.7 million births in the U.S. According to Forbes, who is the leading provider in statistics. I'm making that title up. The average cost to have a baby for just the medical care in the U.S. is about $18,000. The typical out-of-pocket cost is about $3,000. So that's even if you have full coverage medical insurance, you're still paying something, which is like, what's the point of medical insurance? But we can argue or talk about that at some other time. And Justin, I'll let you do this next part because this is more specific to you. But it's like the 3,000 is just like typical. It could definitely be more.
It can absolutely be more. Me and my wife definitely spent a lot more. We did have a C-section, which the average cost of a C-section in the United States is $26,000. That's not the out-of-pocket. That's the total. But for comparison, because I brought up the argument the other day that other countries, you can have babies for essentially free, and the argument back was, well, you got to pay higher taxes in those countries. And yes, for comparison, in the United Kingdom, it costs about $3,000 total to have a vaginal delivery. So that's $18,000 down to $3,000. But they do have on average, about 8% higher tax rate. So you do pay slightly higher taxes, but it is a lot cheaper in other countries to have a baby.
Yeah. Some postpartum stats and facts. So the name postpartum depression was only invented in 1980, and we've been studying since around the time that it was invented. That's like, oh man, why did I say it like that? You ever see that like video where the lady is like a newscaster and she's like, tonight at 10, we'll be talking about the house that burned down because of a fire, and it was burned down in a fire. Just repeating it.
Yeah, it's like, all right.
Yeah. I'll let you keep going. I'm off.
I would say keep going. I believe in you, and I know you can recover.
Okay, all right. According to postpartumdepression.org, about 1 in 10 women who give birth will experience postpartum depression. The number could be as high as 1 in 7, and for first-time mothers, this can be as high as 1 in 5.
So if we extrapolate the data, big sciencey word there, if we have almost 4 million births in the United States per year and 1 in 7 have postpartum, that means about 600,000 cases per year are happening in the United States. So this is affecting a lot of women.
Mm-hmm. It's so important because depression impacts lives of mothers and the baby. It's not just a one-time thing. And I think we talked about depression 2 episodes ago. We did depression part 2. Depression impacts a ton of people. So to have a type of depression completely centered around this significant life event, I think that shows how much it happens, how prevalent it is, and how many people are impacted. In terms of symptoms, they typically last for 3 to 6 months, and 50% of women with postpartum depression, or we, for the sake of the episode, we can say PPD, will never be diagnosed by a healthcare professional.
So the outpatient doctor's office is usually pretty good about monitoring for this. But I gotta say, when my wife and I were in the hospital, there was one nurse who just rushed through all the depression questions.
Oh, no.
And used a lot of leading questions. It was like, well, you're not feeling depressed, right? Right, you're not feeling depressed. And oh man, I sure do hate it when people ask questions like that and kind of gloss over the mental health part of things.
Yeah.
But if you
Did you tell the nurse you're a psychiatrist?
I didn't, because I didn't want to be a douche. Like, actually, ma'am, I am a psychiatrist, and you're asking those questions all wrong.
I mean,
I gave her some slack.
That's fair. Hey, you know what? Nurses are the backbone of our hospital system. We don't need to be shitting on them, but if you're a nurse and you're listening, just take this as a good reminder of, like, maybe we'll slow it down a little. I mean, I use it all the time. Like, it's when we'll talk on the show, like, oh, that's a good reminder that I should maybe do this a little better, or I should be more mindful of this. So always good to remember. And,
to even spread the shit around a little bit. I heard a psychiatrist the other day who was like, you're not having any, like, suicidal thoughts or anything, right? And I was like, come on! It's everyone. It's a whole culture of learning how to talk about this stuff.
Fair. If you have pre-existing depression or anxiety before getting pregnant, you're more prone to getting PPD. In terms of, like, racial diversity, or things that we see across ethnicities and races, Native American women are most likely to get PPD at a rate of 16.6%. White or Caucasian women is 11.7%. African American is 13.4%. Latinx is 11.5%, and Asian women is 7.4%.
Which is curious to me, why Asian population is so much less in terms of that. I wonder, I didn't find anything about the statistics and as to why that is, but it is curious. But also, how about the men, since we do got two bros on here talking about mental health? So one study found that 50% of men who have a wife with PPD, postpartum depression, will also go on to develop depression. So it impacts the dyad, the relationship, the parent relationship as well.
Mm-hmm. An important note is that adoptive parents are also at high risk for developing PPD. I think that's a forgotten set of people. Adoptive parents, or even foster parents, people who will take in children for an unspecified amount of time, they're still at risk for developing PPD even if they're not the one that necessarily gave birth to the child.
I found that fascinating, but it makes sense, because it's just stressful to have a new baby in the house.
I cannot imagine.
Yeah, there's lots of crying, lots of pooping, lots of peeing.
Okay, but what about with Liam?
Lots of crying, lots of pooping, lots of peeing, lots of puking.
I meant more those were issues that you had before Liam got here.
I get you.
I got you, Dana.
Yes, I am in zero control of my bodily functions, unfortunately.
Dana did also mention that you should have your own, Surgeon General warning. That's it. I just want to throw that out there.
Like I'm bad for women. Like, women should know.
No, just in general, because of all your
Well, the last stat on this that we wanted to give you is that the International Labour Organization, and labor is actually spelled Labour, so it's extra British, but they recommend at least 12 weeks of guaranteed parental leave. And 119 countries around the world do this, and the U.S. is not one of them. It sure does seem like our lawmakers could not care less about the mental and physical well-being of women in this country.
What is the average, like, in the U.S.? Do you know?
Oh man! Let's look it up.
I mean, we're here.
Average maternity leave length for women. Oh, surprisingly, one study found the average time off for working U.S. women after having a baby is 10 weeks. So it's actually better than I thought. So go USA.
The part that I think about that, like, we're probably still lacking in is that our maternity, paternity, parental leave is most likely, like, unpaid, while as other countries will, like, keep it paid. So I think that's definitely, like, cool. We got the time off, but then parents are stressing about the fact that they're not getting as much money coming into the household that they usually would.
Yeah. Like, literally, I just spoke to a teacher the other day who said that his wife, who's also a teacher, had to pay to take, like, she didn't have any PTO, so she had to pay to have a baby, pay for that time off of work. And it's just like, classic. That is just insane to me.
Man. So all of these stats, they're here to help us say that having a child can be stressful and depression-inducing for everyone involved. And you may be asking yourself, so why is this? There are a lot of risk factors that go into the development of PPD. One of which being if you have pre-existing depression or anxiety. Another one could be if you've had postpartum depression with other children, if this is not your first child. Low social support also contributes to it. Definitely one person is not enough to take care of a baby. I think you've probably seen that firsthand, Justin.
Mm-hmm. Yeah, it's been wild to me how much it takes. And we've had support from grandparents, from friends, and it still gets overwhelming sometimes. I mean, there's times when a baby is crying, and you've done everything you can possibly think of. You've changed them, you've fed them, they've slept, like they've got a clean diaper, like everything is okay, and they're still just screaming in your face, and it wears on you. It messes with your mental health.
Yeah, I can only imagine. So about 50% of women start to develop symptoms of PPD during pregnancy. Poor sleep and stress are definitely big factors in that.
There's also lots of environmental factors too, like socioeconomic status. So low SES and poor access to healthcare and education are also big factors into reasons why people develop postpartum depression. One study showed that women in poverty are 11 times more likely to develop PPD. That's horrible. That just goes to show you how much the financials impact the stress of having a baby. Also, major life stressors, like a lot of women actually are worried about losing their job if they get pregnant, or if they have a recent loss of a family member. That can be a big thing. Concurrent health conditions increase your risk for PPD, and even a traumatic pregnancy or birthing process can increase your risk for PPD as well.
I've had a number of, I shouldn't say a number, like it's been a lot. I've definitely had friends in the past who, or coworkers who have told me they're interviewing for another job, or they're going to interview for a job, and they know that they're pregnant, but they won't say anything during their interview because they don't want that to impact them getting hired. And I think that's shitty. That's a shitty, having to keep that to yourself, and because you know how pregnant people can end up being treated in our country of well, if you're pregnant, why would we hire you even if you are the best candidate? That part is fucked up.
It really is, and it really sucks that that's how we only view people for their ability to work and be productive for us in this country. We don't really treat people like people. There's a lot of range of symptoms in terms of postpartum issues. And it kind of goes postpartum blues, postpartum depression, postpartum psychosis. So postpartum blues, on the milder end of the spectrum, it's normal to feel down and sad after having a baby. Baby blues is considered that normal sadness that can come after delivery due to a number of different factors, like you're not sleeping as much, you've got a ton of hormonal changes. From a doctory standpoint, there's a dip in estrogen and progesterone that we think is what causes or what increases your risk of having postpartum blues and depression. And the symptoms of baby blues, so those normal symptoms of that sadness that can come from having a baby, are having a little more anxiety, crying more, slightly more irritable, restlessness, tiredness. And typically the baby blues only lasts for weeks and it self-resolves.
Kind of that next part in the spectrum of what could happen with symptoms is postpartum depression. It has a lot of different types of symptoms. So some examples include emotional symptoms, so excessive or uncontrollable crying, persistent feeling of sadness and hopelessness, feeling numb or empty, extreme mood swings, irritability and restlessness, feelings of anger and rage, being easily frustrated, anxiety and fear, and then guilt and shame. And right as I'm reading them, I'm like, man, these are the exact same symptoms as major depressive disorder. It's basically the same thing, just with a different, probably leading or causal event right in front of it.
Yeah, bingo. There are some mental symptoms like poor concentration, memory problems, difficulty making decisions, doubting your ability to care for a baby, and feeling overwhelmed. And again, there's lots of crossover between major depressive disorder.
We'll move forward and also share like some more. Fuck, I fucked that up. We're okay. I heard something in the background. I thought you were stopping. Okay. Next up are physical symptoms, so changes in appetite, poor sleep or hypersomnia, low energy, muscle aches and pain, headache, and stomach ache.
And some typical changes in behavior can look like isolating or withdrawing from friends and family. Feeling like you're not bonding with the baby is another big sign that you might be having some postpartum depression.
Mm-hmm. And unfortunately, with all of these symptoms and things we've noticed as far as trends recently, suicide attempts over the past decade during or after pregnancy have nearly tripled. So it feels like things have just only gotten worse.
Yeah, I think that just goes to show you the level of support for women who have delivered babies in this country is that, man, the suicide rate, amongst other things, is just skyrocketing. It's so sad.
Yeah. I think, too, if you're looking... you talk about like environmental factors. We've talked about this a lot, so I feel like maybe sometimes I just repeat myself a lot. But also, if you're like looking at the news, like how many times are senators and legislators trying to attack the reproductive rights of women? Even if you're gonna have the baby, like you're still living in a society where these old white men, for lack of a better descriptor, are trying to impact your rights, your reproductive rights as a woman. Okay, this is gonna be. It's fine. Grey's Anatomy. Kevin and I have been watching Grey's Anatomy. She got me on it over the last couple of years. And the last episode, I don't want to ruin it for anybody, but it's been out since last week. So if you don't watch it, you don't watch it. But towards the end of the episode, a bunch of the doctors went to Boston for like an award ceremony. And as they're doing the award ceremony, Meredith Grey goes up there and starts like talking about the award they're about to present. And Dr. Bailey is like, why is she up there? Like, I thought I was going to do, like, the presentation of the award. Like, what's going on? Well, she ends up getting the award, and they give her this, like, very prestigious doctory award, and not because of, like, procedures or things she's specifically done, but because of her work that she's done over the season of making, like, a mobile women's health clinic, like, in a van, and, like, the amount of, like, effort she's put into that. So it's, I don't know. I just share that to say, like, if Grey's Anatomy's talking about it, like it's obviously an issue, man. It's fucked up.
Totally. And man, that show has been going on for years and years.
It just got renewed too for another season.
What? I thought for sure this was the finale. Okay.
No, there's no. It better not be the finale, dude. There are some cliffhangers.
They got some work to do. They got to wrap it up. Well, on that spectrum of baby blues, baby depression, now let's move on to like postpartum psychosis. So this is a serious thing that we want to talk about, and there are lots of different things like that go with having a baby. Even postpartum anxiety, like 75% of women with postpartum depression also have postpartum anxiety. Those things tend to go together. What's a little more rare is that postpartum psychosis. And you can have symptoms of psychosis, like true, legitimate psychosis, like hallucinations, delusions, and even flattening of your affect. You're not emoting quite as well as you used to. There's a really high risk for suicide or infanticide, which is why typically in the medical community we recommend inpatient hospitalization for the mother in these situations, because you're not getting any sleep, you have a screaming baby all the time, your brain can have a psychotic episode, and it's actually more common. And I want to really try and get this information out there because I want people to be aware of it so that they can help their friends and family members if this does happen to them.
You know, it's definitely something that I had no idea about. So this is a learning moment for me. I had no idea that postpartum psychosis was even a thing to look out for.
Yeah, and surprisingly enough, the diagnosis, the psychiatric diagnosis that is most likely to have a psychotic episode after having a baby is bipolar disorder. So if you've been diagnosed with bipolar disorder, just be aware, maybe educate your family members about what to look out for, like if you're starting to have hallucinations, if maybe your thinking is not quite making sense. Those are the little signs that maybe you need to start reaching out for help.
Yeah. I noticed you put down postpartum OCD. Can you tell me a little bit more of that? This is another thing I'm about to learn.
Yeah, very interesting. Amongst the wide variety of things that you can get in the postpartum phase, because so many changes are happening to your body and your brain, you can actually get an onset of obsessive compulsive disorder.
Wow.
So if you've just had a baby and you notice that your mental health is doing things that it never really did before, we hope you understand that this is somewhat normal. You shouldn't feel ashamed for it. Give yourself some grace, and just we hope that you reach out and ask for help, especially if it's getting in the way of you living your life, getting in the way of you bonding with your baby. Like, it's not your fault. Just get some help for it so that it can get better faster.
Yeah. The mothers, the birth givers, the child bearers, you are the expert. So please, being able to reach out as much as you can if you start to notice, like, this is more than I can handle. This is more than I've ever had to experience. Like, and my biggest hope is that people around you will listen, because I think there's oftentimes that people don't be listening.
Oh, there we go. Sorry, you froze for a second. It's probably my internet. Where did you leave off? I can just jump right back in.
I just finished right next is your nerd alert.
Okay, I'll jump into nerd alert. Sound good? Okay. So before we jump into treatment options, we want to do a quick nerd alert for this episode, because we like to talk about brains, and nerds love brains, and we're nerds here. So this nerd alert comes courtesy of science.org, and there was a really good paper on there, a good study that showed that pregnancy and delivering a baby actually leads to significant and measurable brain changes for up to 2 years after you've delivered that baby. So gray matter, which is actually responsible for the brain processing. So the gray matter in your brain is like the computer chip. The white matter is like the wires that transfer all the information. So the actual processing unit, the gray matter, shrinks and changes quite a bit after you've had a baby. Up to 2 years after you've had that baby. So loss of gray matter is not necessarily a bad thing, and could just mean that there are changes happening to your brain to make you even a better parent. For example, some studies have shown that the degree of gray matter loss correlates with the level of attachment to the baby. So interesting. Your brain is literally changing and encouraging you to bond with that baby, to become more attached. The hippocampus, which is Ed's favorite part of the brain, loses measurable gray matter, but by that 2 years, it regains what it has lost. So some people think that might just be a reprocessing or reprogramming of that hippocampus. And studies in rodents have actually shown that rodent mothers, after giving birth, there are long-term anatomical brain changes that they think helps them be better at foraging for food, because they have to forage for food for more than just themselves. So it's just fascinating to me how our biology, are from an evolutionary standpoint, is so primed to become parents. Like, our brains are programmed to respond to being parents and having progeny.
It has like it's almost like it has a map or a set of like guides on when this, do this, like this is what's going to happen next. Interesting.
Yeah, exactly.
Yeah. And also, it's my favorite part of the brain, because if you've been here long enough, it's the only part I remember. All right, here we go. I tell you, man, Intro to Neuroscience was tough. Okay, shout out Dr. Island. So as far as treatment, so we have some tips from the Mayo Clinic. Things that you can do. There are things that you can do to prevent and treat this. We hope that it never happens to you, but if it does, it is good to have a plan to get some help. So preventative stuff is trying to get as much rest as possible, which is like, how can I tell that to a new mother with a young baby? I have no right to do so, but I guess just a reminder, when possible, if possible, when you can, please take care of yourself. I know it's tough. Justin, give Dana a little more of a break. Next up, we have to accept help from family and friends. I'm sure that can be tough. I can't imagine what it's like to entrust like your newborn, you just brought this into the world. I can't imagine how hard it is to trust people, even like your most trusted family members, friends. Like it's still got to be pretty tough to trust them with giving you help. So I can understand that part, or I can try to understand that could be difficult, but we want to remind you, when feels comfortable, please accept help from your family and friends.
And I've noticed that there is so much pressure on moms, especially these days from social media. Mm-hmm. It feels like there's this mindset of, you're the mom, you need to be the one sacrificing your well-being for your baby, you need to be the one. And I can see where that comes from, but it's just not helping anybody. And if you need help, please, please, please just ask for it. Use your supports that are there, because, man, it can get overwhelming pretty quickly. Mm-hmm. Some other things that you can do to help prevent postpartum depression from happening is connect with other new moms who are going through similar things. Just be able to connect and collaborate, get advice, have someone who understands what you're going through. That goes a long way. Mm-hmm. Connect with a lactation consultant if you're struggling to feed. We honestly saw a lactation consultant when our baby was just a couple of weeks old. It helped us tremendously, and we really appreciated all the knowledge that she gave us. And another possibly insulting thing to say to a new mother is make time for yourself and your well-being. If you can find someone who's willing to babysit a young baby for a night, go take a night to yourself. Go give your baby to your significant other and take some time for yourself. Do it. It's okay. And honestly, it makes you a little bit mentally better so that you can be a better mom. Having breaks is important and needed.
We're really making ourselves look like jackasses today. We're doing our best to be supportive, but it's almost like no shit, Sherlock. If I could, I would. But I guess this is just us trying to be helpful in the best way that two guys talking about postpartum depression can. From a medical side, so as far as major depressive disorder and postpartum, we typically recommend therapy and medication. Justin, I'm sure you could talk about the medication part more, but as far as therapy, it allows new mothers to process everything that they've been going through, help problem solve, hopefully improve communication skills with family, and then normalize your experiences, because it's brand new. And I'm sure you mentioned that there's about 600,000 births every year. You're not the only person that's giving birth, but I'm sure it can feel like an extremely isolating event and feel like you're the only person going through this.
Totally. And from the medication side of things, medications can be useful, and most antidepressants are safe in breastfeeding. There are minimal side effects that have been studied and found to be really minor stuff, nothing like major conclusions. And studies have actually shown that any side effects that are from antidepressant medications are not nearly as bad as the effects of having a really depressed mom. If mom is depressed, then there are going to be big things that are happening to the baby. It's going to impair attachment, going to impair some of the major things that have to happen between that mother and baby. So please, please, please reach out for help if you feel like this is happening to you. The treatment for postpartum depression is really successful because there is kind of a natural time course of this. Usually this stuff gets better on its own, but if you actually seek treatment, the success rate is about 80% if you seek treatment. So it gets better faster and quickly. There's even new injections for postpartum depression called, the one that is FDA approved is called brexanolone, which is the only FDA approved medicine specifically for postpartum depression. They think it helps slow down the major hormone changes in that postpartum period. And there's some evidence that it might be more effective than a traditional antidepressant. But most people are still using just typical regular antidepressants, the ones that we used in the past. The main thing is, if you're struggling, go get help. Any of these medications are going to help you. The injection might help. The pills are definitely going to help. Just seek help if you're struggling.
Mm-hmm. As we move to the celebrity portion of our show, we want to shout out todaysparents.com. That gives us some example of celebrities who've been open about their postpartum depression experience. First one being Chrissy Teigen. I feel like I used to see her a lot more on social media or like on Twitter. I think she's probably taken some steps back, and if anything, it's probably to give her and John Legend some space from people, because people are mean, man. Like they really are mean. It can be pretty hard. I can only imagine how hard it could be to be a celebrity and have to deal with this, deal with other people. But they had a child in 2016, and they later gave Glamour an interview where they said, and I quote, "I had everything I needed to be happy, and yet for much of the last year I felt unhappy. What basically everyone around me but me knew up until December was this: I have postpartum depression. I looked at my doctor, my eyes welled up because I was so tired of being in pain, of sleeping on the couch, of waking up throughout the night, of throwing up, of taking things out on the wrong people, of not enjoying life, of not seeing my friends, of not having the energy to take my baby for a stroll. My doctor pulled out a book and started listing symptoms, and I was like, yep. And I got my diagnosis: postpartum depression and anxiety."
I love Chrissy Teigen because she's been so open about the things that she has been through, and I think she's got a great platform. And women love her. And John Legend is fantastically talented, so good for them.
Shit, it's not Teigen?
I think everyone calls her Teigen, but then there was something that came out a couple years ago that said, like, actually it's Teigen, but she never really corrected anyone, so who knows? That's
like Ariana Grande. Like, if you look it up, apparently it's supposed to be like Ariana Grande or something. Like, it's like different. Like, like, come on. I don't know, man. Anyway, one thing I'll say before you move on to the next one, it made me think of this. There's actually a thing recently within the last like week or so, and this is not necessarily postpartum depression, but just like the difficulty it is to be a single parent. Like, even Kim Kardashian came out and said like it's pretty hard to be a single parent, and like I had a mixed reaction the first time I read it. It was like, well, you're rich as fuck, like can't you like handle it? But then it's like, okay, let me take a step back. Like, if there's one thing we've said on the show over the last almost 4 years, is that mental health does not give a damn who you are, how much money you got, what resources you have. You can still be impacted. So I think we should still give her grace. Like, for her to come out and say that, like, my hope is that it was normalizing for people.
Good. And I kind of like Kim Kardashian. I like what she's doing with the legal system. I like that she's trying to get innocent people off. I think maybe she got her fame based on purely superficial things and her looks, but I think she's trying to turn it into something deeper, and I appreciate that about her.
I don't know if I can remember a reason to not like her. I'm sure someone can remind me, but I don't know if I have a reason. And I'm not saying I don't like her. I think, like, similar to you, like, I don't know if I think she gets hated on a lot probably for the reasons you're mentioning, but I don't know if I feel the same way.
Yeah, it seems like when anyone gets too famous, then there has to be a backlash. It's the Dane Cook effect. Like, he was the biggest stand-up comedian in the world, and all of a sudden everyone was like, I hate Dane Cook. Like, all right, whatever.
He also has like a 19-year-old girlfriend. Like, that's kind of weird. Like, that he may have like met before. Anyway, that's a different show. All right, next up.
Yeah, I didn't know that part about it. I take back what I said about Dane Cook. I don't like him.
Perfect.
Well, up next we have Drew Barrymore. She got postpartum depression on her second child, not her first. So it took her by surprise when her response to having a baby was totally different than her first one. She had symptoms for 6 months, and she said she made a lot of work-life balance changes that helped her get past her depression episode. So I really appreciated that about her. And then the last one, and I've started using this term with my wife. It's like, Ed, I don't want to trivia shame you, but do you know who Brooke Shields is?
While you're doing it, it sounds familiar. Let me look her up. All right, let me.
She was a very popular / actor. Yeah. Has been around since the 80s. So my wife and I just watched her documentary on Hulu called Pretty Baby, and It was really good. It was a fantastic documentary, just giving us the context of how she was 14 years old when she was a major sex symbol, which is a little creepy, and hopefully that changes and continues to change. But in the documentary, I had actually just written the script for this episode, and she was talking about her experience with postpartum depression, and I was just like, oh my God, this is PPD. And then she went out and said it. I was diagnosed with postpartum depression. So she actually had a quote that was my own quote, but I'll edit that part out. But she came out and said that she had postpartum depression and was actually treated with medication and therapy. Then, of course, Tom Cruise had to make a comment and take a shit shot at her. And I just learned this term called a shit shot. Have you ever heard that before, Eddie?
No, this is my first time.
I'm working at a new rotation. It's like an adolescent substance use program, actually. And they say this all the time. They're like, you're taking shit shots. I'm like, I love this. I don't know what it is, but I love it. So Tom Cruise took a shit shot at Brooke Shields and said that she was spreading misinformation about mental health, even though she was just telling her story and her journey. And it reminded me of how crazy Tom Cruise is, or used to be at least. And he's still a Scientologist.
Still
and
is,
Scientologists tend to be very anti-psychiatry. And honestly, I don't blame the Scientologists, because psychiatry does not have a stellar past. But I think there is a new generation of psychiatrists that are trying to change that perception, change that history. And either way, luckily Tom Cruise apologized and accepted the fact that Brooke Shields went through something very difficult, got treatment, got better, and was able to help a lot of women by sharing her story about postpartum depression.
Yeah. Screw you, Tom Cruise. I'll let you say the last names, the last celebrities we got, Justin, because I'm going to butcher some last names. So hit me with it.
So other people who have also had postpartum depression include Hayden Panettiere.
Yeah, I was going to mess that up. Yep.
Celine Dion. That was my best Celine Dion impression. She's a little nasally there. Britney Spears. Amanda Peet from Saving Silverman. Vanessa Lachey. Courtney Cox. And Adele. So lots of people.
I shouldn't laugh, man. See, thank you for saying the names, because I was ready for Vanessa Lakey. Ah, damn it.
I love you, Eddie. And
thanks, man. I love you
everything
too.
That you are.
Some take-home points. I would try to be serious for the last 2 minutes. I guess the biggest thing is we really hope that if you're struggling and you reach out for help, people will take you seriously. And our hope is that if you learned anything from today's episode, whether you're someone who can potentially give birth, whether you're someone who will be the support person for someone who's going to give birth, please take them seriously. Please offer up help. Please be as supportive as you possibly can.
Yeah, and I guess my take-home point for today is, from deeply from the bottom of my heart, Tom Cruise sucks.
You too, Ted Cruz.
Yeah, Tom Cruise, Ted Cruz. All the Cruises, really. But no, honestly, just to piggyback on what Eddie said, this is a thing. This is a real thing, and a lot of women suffer. And like we said earlier, only 50% of women actually get help for this. Over 500,000 women that get this per year. Please don't suffer in silence. Please reach out for help. Tell someone. Try and see a doctor. Try and see a therapist, because you don't have to suffer alone. And getting help can help you really a lot with yourself, with your baby. There's just only good can come from getting help.
Absolutely. With all that, one last shout out to all the moms, caregivers, parents out there. We appreciate you, and we're here for you. You can get this episode and any other episode wherever you get your podcasts, on Apple Podcasts. If you'd like, you can leave a 5-star review. You can even leave us a comment, and we'll read it at some point in the near future. On Spotify, you can leave a 5-star review. Follow us on Instagram, TikTok, Twitter, and at YouTube at MillennialMHC. Thank you all for listening. Thank you all for the support. And as always, take care of y'all mentals.